Hello, my name is Kelly Santarosa. I'm a Senior Policy Analyst with AUMA, and this is the last webinar in our Healthy Futures webinar series, so thanks for joining us. The series has been a partnership between AUMA, RMA, and the Alberta Policy Coalition for Chronic Disease Prevention. And I'd like to turn things over to Kayla to get us started.
Great, thanks, Kelly. Hi, everyone. My name is Kayla Atke. I'm a policy analyst at the Alberta Policy Coalition for Chronic Disease Prevention. Welcome to our webinar, Food Matters, How Municipalities Can Build Stronger Communities Through Healthier Eating Environments. This is the fourth and last webinar in our Healthy Future webinar series, so thanks everyone for joining us today. Guest speakers for this webinar will include Dr. Kim Rain, a professor at the University of Alberta and also the co-lead of our coalition, and Pamela Boyson, a public health dietitian with Alberta Health Services. Here's the outline for today's webinar. Following a brief introduction to the coalition, Kim will explore why food and nutrition policy matters for municipalities and will highlight local engagement around Alberta's nutrition report card. Following this, Pam Boyson will discuss how you can work with local partners to achieve nutrition policy goals, what's going on in Alberta in this area, and resources to support your efforts. We'll end the presentation with time for comments and questions. A little bit about the coalition. We're a group of 17 health organizations from across Alberta based out of the University of Alberta School of Public Health. And as I said, we're co-led by Dr. Kim Rain and also Dr. Candace Nikiforuk. Together, as a group of 17 organizations, we work to advocate for healthy public policy to reduce chronic disease in Alberta. And here are our 4 key objectives. So we focus on increasing the capacity of policymakers and decision makers in Alberta to use policy as a strategy for chronic disease prevention, provide leadership in the development, implementation, and evaluation of policy-related activities, promote and inform policies that advance health equity, and facilitate various actors in working together to enhance public acceptance of policy-related activities. When it comes to reducing chronic disease in Alberta, our work broadly focuses on addressing behavioral risk factors for chronic disease. Key areas of focus for us include healthy eating, active living, tobacco reduction, and alcohol-related harm. So today we'll focus in on healthy eating. And finally, our work does take a policy focus, emphasizing the important role that policy can play in creating environments where healthy choices are easier for all Albertans. So we aren't simply focused on encouraging individuals to eat healthier or get more physical activity, for example, but on how policy can be used as a tool to address the underlying factors and determinants that create barriers to these goals. And so I'm just going to pass things over to Kelly to do some polling before we get started with the presentation.
Thanks, Kayla. So just 2 quick questions to kind of see who's on the call and the kind of work that you're doing. So you should get a question popping up in your screen that asks what sector you're from. So just go ahead and click the applicable answer, and we'll give you a couple minutes to put that in. Okay, so let's have a look here. Okay, a lot of people from municipal government, which is great, and some people from primary care, next highest, and other. All right, thanks very much. And the next one, and this is, you can click more than one. You don't have to just click one, you can multiple. So it's just, how is policy work part of your job? So are you an advocate? Do you help build business cases or evidence for new policy, contribute to policy development? Are you more on the implementation side, monitoring, evaluation? Are you just interested, or is policy not part of your work? So again, we'll just give you a couple minutes to select the answers and submit them. Okay, so looks like a lot of advocates and a lot of people that work in policy development. So I'll turn it back over to you, Kayla.
Great, thanks, Kelly. And thanks everyone for being here today. So with that, I'm going to introduce our first speaker, Dr. Kim Rain with the University of Alberta and co-lead of the Policy Coalition. So I'll hand things over to you, Kim.
Thanks, Kayla. Good afternoon, everybody. Thanks for joining in on this strangely weathered Friday afternoon. So I'm going to talk about how food matters for municipalities. In addition to being a professor, I am a registered dietitian and have been for many, many decades. So it is something that is very near and dear to my heart. Basically, why do healthy food environments matter for communities? And I'm going to take a couple of minutes over the next few slides to explain this. But one of the things that we do know is that dietary risks are one of the leading causes of death and disease in Canada following tobacco use. And, you know, I think most of you would be aware of how damaging tobacco is to our health. But the interesting thing is that diet is, as Kayla alluded to, diet is actually more than a matter of personal choice. It's actually dependent on our food environments. So, for example, if you have young kids and you go to a hockey game at an arena when they're open, and afterwards, after the game, you go out to have a snack and there's nothing there except for poutine and pop, then that food environment is not facilitating a very healthy diet. So the food environment is something that municipalities have a fair amount of control over. Municipalities do indeed have a strong influence on the diet of residents, just like municipalities over the past 20 years or so have been using policy to control tobacco use in public. So we're going to explore this a little bit more today. As I mentioned, with respect to causes of disease, this is a global burden of disease study, which is it is a global study, and looking at the causes of death in countries around the world, and this is particularly for Canada. And this is actually looking at behavioral risks, so many of the risks that the Policy Coalition addresses. So as you can see on this slide, tobacco is the number one killer, and then that comes right after that, very closely behind, is dietary risks, and that is related to things like cardiovascular disease, some cancers, and things like diabetes. Alcohol is way down, and low physical activity are number 3 and 4, but way much lower than tobacco and diet. So it is something that's really important for us to pay attention to. And as I mentioned in the introduction, food environments are a big part of what influences our diet. We know that food environments shape the availability, the affordability, and the social acceptability of food and nutrition choices. And I put choices in quotes because sometimes it's not a true choice if, for example, the hockey arena example plays true. We also have seen in the past decade a growing body of research showing us an association between food environments and diet-related outcomes. And I'll share some of that data today too. So because we know that food environments are so important, and because we know that diet is such a major cause of chronic disease and ultimately death, one of the things that our group has done is we have actually developed a nutrition report card. It's called Alberta's Nutrition Report Card for Children and Youth, on food environments for children and youth. And we developed it back in 2015, and for any of you who are interested in the research behind it, we did publish a paper on it, and we have another paper coming out within the next week looking at the first 5 years of experience. But we were really inspired by the Participation Physical Activity Report Card, which every year comes out and sort of says, you know, is physical activity extinct, and interesting approaches to that. So we thought we needed something for nutrition as well. So they inspired us, and we developed this nutrition report card. Now, what the nutrition report card does is it looks at the domains of the food environment. So we start with the physical food environment, which is basically what's available. So what's available in recreation facilities, what's available in schools, what's available even in your neighborhood in terms of zoning of types of food outlets. Then we also look at the communications environment. What are the messages we hear? So what are the ads that kids are exposed to, which could be on a billboard or on the side of a bus? So those are things that municipalities have some control over. Then things like, what are the costs? I mean, is it actually affordable to consume a healthy diet in Alberta? And then what are the attitudes and beliefs? Sort of that's that social environment. You know, how are we? You know, what is it? What's cool and acceptable to eat? And that's going to obviously change depending upon the social group you're involved in. And all of those environments are embedded in the political environment, so the policies that municipalities may very well have some control over. So as I mentioned, we've been doing this report card for about, we've done 5. We're collecting data for the 6th, the 2020 report card, which will be released in September. And in 2018, we actually did focus on the role of municipalities. And I'll break this, you cannot read, I know, so I will break this down as we go through just to give you a few ideas of the types of things that we're looking at using the most recent 2019 data. So, for example, I'll come back to that recreation facility example. One of our indicators is around having high availability of healthy food in community settings such as recreation facilities. And consistently we've given a D on this indicator in our report card over the past 5 years. And it's because when we look at, this is some findings from an audit of what recreation facilities were actually providing. And the red is not particularly nutritious food, red for stop. The green is our healthy, we call them choose most often items. And then the yellow is sort of a cautionary area. So, you know, when we look at, for example, foods that are available in recreation centers, by and large, the vast majority fall into that choose less often or red zone, and very small amounts fall into those healthy options. If you consider that bottled water would be something that we would consider a healthy option, that's probably where most of those choices are coming from. So when we look at municipal recreation, some of the recommendations that we have is perhaps to mandate changes to improve the healthfulness of the availability of foods using the Alberta Nutrition Guidelines for Children and Youth, which I know Pam is going to discuss shortly later. So to inform food policy and maybe develop vending contracts that ensure that healthy foods are available. So there are, those are just one example of a recommendation that we could have in the municipal recreation sector. It could actually go beyond recreation. We know that in many municipalities in other provinces, there is some look at all publicly funded buildings and institutions. So that would include things like hospitals, schools, and recreation facilities, of course, but even public buildings like City Hall, town buildings, that type of thing. Our group published a paper a few years back looking at healthy food procurement and nutrition standards in public facilities. And what we encouraged was all publicly funded institutions to implement healthy food procurement policies as part of a broader vision of food policy that promotes health, environmental sustainability, and supports local economies. In other words, we don't think that public money should be spent on purchasing junk food for the public, but that healthy choices could be a way that municipalities could make those changes. Just to give a plug for the Policy Coalition does have a resource hub, and on that resource hub there are some examples of policy stories of how, for example, the city of Hamilton ended up with a corporate food and beverage policy. And there's even an example from St. Albert on how they used calls for proposals for food vendors in their recreation facilities to change their food environment. Healthy zoning is another area that we could take a look at. So, for example, one of the things that we look at in the report card is whether or not there are convenience stores or fast food outlets close to schools. We do have an indicator on that. And that's based on some research that basically shows, and this is Canadian research out of Ontario, but I don't suspect it will be very different from what's going on in Alberta, that shows is that if you live close to a recreation facility, that you're less likely to be overweight or obese as a child, and that if you live and if your school is and home are within 500 meters, that's called a walk zone, of fast food or convenience store, you're more likely to be overweight or obese. So that's one of the reasons why we include this as an indicator in our report card. And so indicator 5 is limited availability of unhealthy food vendors, traditional convenience stores, and fast food outlets are not present within 500 meters of schools. And again, we have seen consistently a D in Alberta for this particular indicator. And I'll just show you examples from Calgary and Edmonton. We have used a couple of other smaller communities as well, which are not doing really any better in our report card. But like, for example, in the city of Calgary, only 32% of schools, and in Edmonton, only 27% of schools actually have no fast food or convenience stores within walking distance. And, a similar amount, about 30% in both Edmonton and Calgary, have 5 or more fast food outlets within walking distance of schools. So that's something to consider. And just, again, to give a plug to the Policy Coalition, some of the resources on the resource hub for the Policy Coalition's website talk specifically about using urban planning to offer healthy food environments around schools, and also to limit things like drive-through. We have done, for the past 10 years actually, about every 3 years, we've done a survey of decision makers, provincial, municipal, and school board level around food and nutrition policy, and we are finding, and we also do a similar survey of the public, and we are finding that there is a growing support for some policies, such as mandating healthy foods in schools, and even taxing sugary drinks, and perhaps even subsidizing healthy foods, which interestingly could be used. A tax on sugary drinks could be used to support such a subsidy. I'm going to finish up really quickly now and just give you a few examples of some local engagement, because the report card has, for the past 5 years, has really looked at the provincial level, but we have over the past 2.5 years started engaging smaller communities in collecting their own data around food environment. So we've partnered with the local health system, such as community health facilitators and dietitians. One of the first community dietitians that we partnered with was Pam Boyson, and so she's going to give you some concrete examples of what's gone on in the communities that she serves. And we've identified communities that have prioritized healthy eating for action, and we started out with a community orientation workshop. Until very recently, they've been face-to-face. We actually had one over Zoom a couple of weeks ago. So that people understand what food environments are about, and they think about where they would like to collect some local data. So far, we have about 20 communities, and they range in size from villages of 500 to cities almost 100,000. I haven't named them on this map. I just want you to see that they're spread throughout, because not all communities have agreed to have their names shared, and although some proudly share their report cards on their website, so it's something you might have a look for. But basically what we do is we have I hate to call it an app, because it's not as fancy as most of the apps we have on our phones, but people are able to use their smartphone or tablet to answer an online questionnaire around food availability. They can take pictures to capture pictures of the menus or what's in vending machines, and then they transmit that centrally to the university, where we have a team that does an analysis. So just to give you an example, here's a hockey arena menu in a small town that one of the communities took a picture of and sent in, and we looked at what was being offered. And I won't go into it, but I'm sure you can imagine it's mostly burgers and fries and such. Here's a picture of what the children's cereals in grocery stores, mostly high sugar. And here is a picture of the vending machines in a public building. This is a hospital, so it's a little bit scary, considering that hospitals are supposed to be promoting our health, because what we're seeing there isn't particularly good food. But so what we do then is we create a mini nutrition report card, feed the results back to the community, and then the community comes up with their own recommendations that they can act on locally. And the communities have been really enthusiastic about collecting local data. It has increased their appreciation of the role of food environments in shaping people's choices, and it really concretizes and localizes that power of policy. So people have influenced local businesses to stock healthier food products, and some of the schools, for example, that have policies in place but may not have been following them. There has been some encouragement for those schools to implement and adopt those guidelines as policy. So I'm going to finish there and turn it over to Pam. There is a link here where the nutrition report card can be downloaded from. It is on the Alberta Policy Coalition for Chronic Disease Prevention website, so I would encourage you all to go there. I'll turn it over to Pam. Thank you.
Well, thank you, Kim. That's a really good introduction, and now my role is to dive in a little deeper and give you some community examples of some of the things that Kim was talking about. We've had a lot of really great examples across Alberta, and so I'm really happy to be here to share them with you this afternoon. So I want to show you some things that are happening in various settings. I'm going to focus on a few settings that we in Alberta Health Services have worked a lot more. So things like the zoning and taxation are, a little bit newer for us, but we definitely have some experts in the field that can share some of that. So without further ado, I'm going to dive in here. So one of the things I wanted to share, and Kim alluded to, is how your local public health partners can help. And so we might be the local health experts. So for instance, as a public health dietitian, we have expertise in nutrition. And one of the things that's worked out really well is we've been partnering with these communities around Alberta who are participating in things like the benchmarking food environments or healthy Alberta communities, or just any communities that are within our areas that we work, to be able to help them kind of navigate, what can we do, what are some quick wins, let's celebrate what we're already doing, and then let's look at where we can make some improvements. So we are scattered across Alberta. I believe there's 35 of us. Some of us work part-time, but at the end of the presentation, I will give you a link as to how to find the local public dietitian in your area. But we are more than happy to help you do this, and we've gotten, now that we've gotten a few of those out of the way, we're getting really good at collecting this data and, coming up with recommendation and supports. So I'm going to focus on the settings, like I mentioned, that we've worked more exclusively in with Alberta Health Services. So I'm going to focus on schools, Alberta Health Services facilities, workplaces, and recreation centers. So we know that there are many more public buildings and facilities in municipalities, but I'm just going to share because these are the ones we've worked in the most, and we look forward to diving deeper into those other ones that we haven't explored yet. So schools have been working in, as Kim mentioned, with the nutrition report card, and that schools have been working in for a lot of years now. Many schools have nutrition guidelines or nutrition policy at their division level, and then procedures that each school is to follow in terms of what are healthy foods. And I noticed that there was a question there around, what are we using to determine what healthy foods are? And you'll notice this picture here. So we have the Alberta Nutrition Guidelines for Children and Youth, and what that breaks things down. They use a food rating system. So as Kim mentioned, the green light, red light, and yellow light. We kind of break foods down into the green being choose most often, the yellow being choose sometimes, and the red being choose least often. And there's nutrition criteria for each of those things. So I encourage you to have a look. So there is one. This booklet covers all three areas, so schools, child cares, and recreation facilities. But there are some lower literacy or easier to read and navigate ones that are for each of the three specific areas. So I encourage you to look at those, and also to connect with your local public health dietitians, because we are well versed in these and can help you navigate through and find some tools. So schools use a comprehensive school approach, which is something that we've learned a lot over the years about, and we're now transferring that into the work that we do in other community settings. So looking at the social and physical environment, so that's the food environment, everything from a place to eat to is there healthy food available, the teaching and learning, so are we providing that education around why is this important, what are healthy foods, why should we even care about healthy eating, having policies in place to make sure that whether if you have changeover of people who run your food service operations or vending contracts, et cetera. So having some sort of policy or structure, contract or lease agreement, and that in place really helps to solidify that those are going to be sustainable changes, that no matter who's in place, those will continue. And then those partnerships and services, so knowing that you're not alone in doing this and that there are people in the field that can help you make those changes and be successful. So in terms of AHS facilities, I know Kim mentioned that that vending machine that had all those horrible choices in there, that it was a hospital facility, and we are not exempt from needing to make some improvements. But we do have a commitment from our leadership at Alberta Health Services, and we have a healthy eating environment initiative. And what we're looking at doing is supporting staff and visitor wellness. So we've done surveys over the years to engage both staff and patrons. And they do support that having healthy foods available does help them to improve their eating habits. And so we're trying as a healthcare organization to be a role model, and we know that we need to lead by example. And so we're trying hard to make those improvements. They're very slow, as we know that change takes time, but we are trying to do that. So the goal of our initiative is to make healthy eating easier where food is provided, sold, or eaten. So for example, some facilities have replaced sugar-sweetened beverages in cafeterias, vending machines, and that had introduced more water and sugar-free options. So that's been, and even in some of our bigger centers that we've done that. We have an organizational commitment, and this initiative is aligned with our people strategy at Alberta Health Services, making sure that we have a safe, healthy work environment. So where we've looked at the two AHS policies, we have a travel and work session policy and a healthy eating environment policy. So these strategies and policies provide the direction to change, and they're also trying to make this a reality for our staff and leaders to work together so that we can also have healthy places to be role models, but also as healthy workplaces for all of the staff. So some of the work that we've done in workplaces over the years is look at some of the different ways that we can incorporate healthy food into the business that we're doing. So looking at healthier meetings, some of the food that we bring in. Oftentimes when we're looking at meetings, you're sitting for long periods of time, kind of thing. And then sometimes we tend to if everyone's probably been to a conference where you've been overfed. It's all you felt like you did was eat and didn't move around a lot. One of the things that I'm the most excited to share with you today is that we have had a series of potluck sign-up sheets that we've created. And it's all around everybody signing up to bring one ingredient to then participate in this wonderful lunch. So we have one for breakfast meetings, so how to set up a breakfast bar where everybody brings an ingredient. We have a healthy salad bar. We have a how to build a healthy wrap or sandwich bar. We have a taco salad fiesta, and we have one around power bowls being a more trendy kind of thing to do. We have done this in a lot of our different staff, in our different workplaces. We've also shared it with our school partners and some of our other external partners, and people are really enjoying this. It's also a really inclusive way. So for people who maybe aren't really adept at cooking, or maybe don't have the financial means to bring a whole dish, and that maybe they sign up and they bring a can of beans, and then they get to participate in the wonderful lunch. So we have those available on our website, which I'm going to share with you later, and it's under the Healthy Eating at Work. We also, for celebrations and events, we might think about, we try to think about the frequency of things, and it might seem like we only do this once in a while, or, I only do that once a week kind of thing. But when you add up all of the celebrations and the events and the meetings and that, it can really add up to a lot. So one of the things that we've started doing is, we have people on kitchen cleanup duty in our staff room. So what we'll do is often have everybody who's on kitchen cleanup has to bring a goodie for the birthday celebration of the month. And we've started doing things like everybody bring a piece of fruit and make a big fruit salad to share. And so just trying to find ways to incorporate more healthy eating so that we can still have that connection with people, but it can be over the healthier food so that it's not always in your face. So I want to take some time to highlight some of the communities that we're aware of that have done some really great work. And I'm going to start with Castor. When this benchmarking food environment project was released, as Kim mentioned, where they started doing the mini nutrition report cards, Castor was one of the very first communities to come on board. So the reason why I'm going to highlight Castor is because they're further along in the process of implementation. And so we're actually seeing some of these changes having come to life. So one of the things that they decided to do as part of their project was they realized that their recreation center was an area where they really needed a lot of work. So they did some focus around this. So some of the things that they did is they changed their signage to promote healthy food options. They completely removed their vending machines. That was just when they renovated, they just decided, well, maybe we just don't need them anymore. They really looked at partnering with their sport associations and hosting healthy team meals. So instead of everybody going out to a restaurant or only having the option of having things like fries and that off the menu, knowing that some of these sports teams really wanted healthy food to fuel their performance, they started offering these healthy team meals. It was a way for them to boost their revenue while also making sure that the teams had healthy food available to them. Equipment has become a big thing, and they purchased a cold table to better help them prepare sandwiches and salads. And they also looked at promotional items like magnets and water bottles to help, let everybody know why they were doing things and to celebrate some of the things they're doing. Another thing I wanted to share about Castor that is really exciting is that through this work of the benchmarking food environments, they went one step further to develop a Town of Castor wellness policy. So it covers 5 domains: physical wellness, intellectual wellness, community inclusion, healthy built environment, and economic wellness. This is really exciting. Their wellness policy is available if you just search Town of Castor Wellness Policy. You can get it right off their website. But what I wanted to highlight today, just for some, for those who are thinking about, what would I put in that kind of policy or that kind of thing. So what they've got there is they've got the town obligations are to provide and promote affordable and meaningful recreation opportunities, to encourage the use of walking trails and facilities, to investigate and explore resident and public input to assess community needs, to strive to support healthy food and beverage choices, to promote and support learning activities, opportunities, and community events, and provide and maintain areas where individuals may participate in a healthy, active lifestyle. So this is one of those things that I appreciate when municipalities are coming together, is to just try to have a little bit of a health lens when they're looking at things and how we can improve the quality of life for our residents. So a big shout out to Castor for that work. We've done a lot of work in recreation centers over this last number of years, which is a real area of passion for a lot of us, and we've seen a lot of great success. So I'm excited to share some of these things. So one of the things that has been a common thread among many of these rec center successes has been around the changes to vending. And I want to highlight one. We don't usually highlight companies, but I do want to highlight Mac Munchies, which is a company in central Alberta, only because as part of their healthy eating initiative, they created signage and they created a way to label their products within the vending machines so that people would know what are the healthier choices. But what was really interesting about the work that Mac Munchies did is they actually saw a revenue increase when they increased the amount of healthy options. So we have seen some other vending initiatives, for instance, Vegreville has just completed their benchmarking food environment, and they're looking at having all healthy vending. So that's really exciting, and something that we can see great success in. We've also seen really great examples in Lethbridge and in Camrose. And that's one of the things that we've developed over the years, knowing that vending, in various settings, whether it be schools, recreation centers, public buildings, et cetera, is that we've created a healthy vending toolkit at Alberta Health Services. It kind of goes through everything from how to find a vendor, planogram examples, like how you would set up your healthy vending. So it just answers a lot of those questions. So I encourage you to look for that as well, and that's under the Healthy Eating in the Community section of our website. So we've worked with ChooseWell, Communities ChooseWell. So lots of communities have benefited from grants and different opportunities with Communities ChooseWell, as well as many of us public health dietitians had the great fortune of working intensively with some rec centers through the Eat, Play, Live study that ended up being a national study, but we were one of the provinces here participating in. And so we got a real in-depth look at working with recreation centers and finding out what are your needs and what's holding you back from having healthier food options on your menu. And so some of it really was around those equipment changes. So I mentioned Castor got a cold table. This has also been a recurring theme in many rec centers that we've talked to, is just by having a cold table or a sandwich table, whichever you want to call it, and having somewhere where you can have all of your fresh veggies and all of those things prepped and ready to go, it makes it feasible to make salads and sandwiches just as fast as you could flip a burger. So without that, it was just a lot of running around, and it was a very inefficient process. And so it did take a really long time to produce these healthy options, not to mention keeping the produce fresh, et cetera. So this, for some, this was the change agent right here. I've had other rec center who had, they did a big renovation in their rec center, and they took out their deep fryers and put in combi ovens. So it was an expensive kind of project at the beginning, but it paid itself off very, very fast. And what that meant is that everything that used to be deep fried could now be put in the oven and cooked, by convection oven, and the taste was still fantastic, but yet you've decreased all of the fat that used to be in there. We've also seen a lot of increase in water refill stations in schools and community buildings, even in some parks, and that we're seeing a lot of these. And this is really encouraging people to drink more water, which is something that we are really, as dietitians, focusing on water being the drink of choice. So the more that we can offer free, quality tap water, the better. And so some of these have used grant funding, et cetera, to put in some of these stations. So there are some other ways municipalities can improve their food environments. I'm just going to go through a few, but as I mentioned, this isn't an exhaustive list. There is another initiative called Healthy Alberta Communities, and there's a number of communities, I believe probably around the 20 mark as well, that are in various phases of this project. That are doing some really great work. So a lot of them are promoting local foods, and this has become, something that's happened lately, where people have kind of looked to local, to supporting our local businesses, finding out so that our food doesn't have to travel as far, but also not just the promotion of local foods, but also the cooking skills, and that, in a lot of cases, families today, many don't have cooking skills to be able to prepare these healthy foods. Healthy food supplied at events, so there's a lot of work being done at public events, et cetera, so to make sure that the healthy choice is becoming the easier choice. So these are just a few examples, and again, there'll be a lot more coming out as you'll see the stories. There is a Healthy Communities Hub if you search that on the website, and there's lots of examples that go into more depth in terms of which communities are doing some of these great things. So we have the great fortune of having Dr. Karen Lee with us in Alberta. We've learned so much from her, from what she's done in her New York City work around the FRESH program, around zoning and tax incentives. And we're so fortunate to now have her in Alberta working both at the University of Alberta and also part-time with Alberta Health Services as a medical officer of health. So we are learning so much around how to zone and different tax incentives and just how we can participate and partner with municipalities. And so I won't go into a ton of detail here, but we just wanted to share with you some of this work that's available, and you'll see her website here. But she is now a resource that we have here in Alberta, and somebody that we're working with in our work to make sure that we have some of that insight of working with municipalities. And I believe she is on the line, so if you do have questions specifically around the New York Fresh program, she'd be happy to answer them in the question period. So now I just want to take a couple of minutes to just share with you some of the resources we have here in Alberta. So this is the website I was referring to throughout the session here, healthyeatingstartshere.ca. This is our nutrition services website through Alberta Health Services. And it's got all sorts of different settings that you might find. So Healthy Eating at Work, that's where you would find those potluck sign-up sheets. Healthy Eating at School, we have a ton of resources. We've been working tirelessly over the years at resources for schools, both curriculum-based lesson plans as well as how to change your food environment. You'll see child care and learning care centers, as well as healthy eating in the community, and then general resources. So that that healthy vending toolkit is under healthy eating in the community, and then the resources I'm going to share with you in the next slide are also going to be posted under this healthy eating in the community section. So we're really excited. We've been working over the last year and a bit. So based on some of the findings that we had in working so extensively with recreation centers on the Eat, Play, Live study and through the Healthy Alberta Communities and the benchmarking, one of the things that we found was that it wasn't that food service outlets didn't have healthy items on the menu. What happened was they either weren't promoted well, or they were priced way more expensive than the less healthy choices, et cetera. And so all of that learning led us to kind of go, well, what if we help them market healthy food and drinks? That would help them sell them, help them be able to better use their products for multiple things, so that we could decrease food wastage, because we really wanted them to have healthy options on the menu, but also for them to be profitable. So we've just created a series of 11 infographic posters. We've based them on the 4 Ps of marketing. So you'll notice some placement, price, promotion, and product. So under the product, a lot of what we're trying to do is help food service operators also determine what are healthy foods. So everything from the healthy cooking methods, how to replace and substitute items in recipes, what are healthy side dishes, some ideas like snack packs, et cetera, that really appeal well to sports teams, et cetera. And so we really just tried to guide those through. So that's a brand new resource, and I'm just going to go to the next slide and just show you what they kind of look like. I could only fit 4 on here, and then, like I mentioned, there's 7 other ones. So they're just really simple, but they've got the kind of the key messages, and there's something that I think is going to be really helpful for people in terms of like making those healthy choices, but also looking at how they're placing and promoting these items for better sales. Another thing that we've partnered on with Choose Well and the Policy Coalition is the Healthy Eating in Recreation Settings e-course. So this was kind of a labor of love. We always try to bring people together, but it seems like with competing schedules, et cetera, it's always really hard. And so one of the things we decided was that maybe if we developed some online modules that people could do at their leisure, that were quick, simple, interactive sessions, that we could then offer those to people online. So this is brand new. It was just launched this week. It's online on the Choose Well website, which I'm going to show you on the next slide. But basically we created 8 different modules. They're about 15 minutes. There's the 8th modules on sport nutrition. So it takes a little bit longer. It's more between the 15 to 30 minutes. But they're just simple, guided kind of modules. They have interactive little quizzes, et cetera. They're done with nice bright colors to help you with everything from assessing your recreation environment, writing healthy policies and contracts, revamping concession menus, making a business case, and sport nutrition is one of the other ones. But we really wanted people to be able to gain actionable skills and then have the resources and the community examples to help support them in moving this forward. So we're super excited that this is just launched. So as I mentioned before, this is on the communitieschoosewell.ca website. And they've just launched a brand new website, so it's got a cleaner look and it's really easy to navigate now. So I encourage you to look on there. And Alicia Christensen is the contact there if anyone has any questions about that. I just wanted to share 2 other opportunities with you. So Dr. Karen Lee, who's with us now in Alberta, is working with the University of Alberta on the Housing for Health initiative, and there's an opportunity to join a subcommittee called Healthy Community Guidelines. And I do believe the first meeting of that subcommittee will be May 28th. And so if you are interested, we can certainly make sure that we get you the contact information of that. There's also an Alberta conference likely in October on the Fit Cities, Fit Towns. So that lots of things to come, and hopefully, by doing some of these things and sharing some of these resources ahead of time, that hopefully by that time there'll be a lot of interest in this. There's also some upcoming courses. So Dr. Karen Lee is also partnering with the University of Alberta Extension course, Creating Healthier Communities. So that date hasn't been set, but it is likely going to be in September. So that was supposed to happen in the spring, but now will happen in the fall. So lots of time to now get people interested in that. And then Dr. Karen Lee, if you go to her website, also has information on case studies and international work that she's participated in as well. So I think we'll open up for questions. I just wanted to share that if you did want to get in contact with your public health dietitian that's in your area of the province, if you just go to publichealth.nutrition@albertahealthservices.ca, so ahs.ca, then they'll get you in contact with the person that is in your local area. So thank you so much.
Great, thanks so much, Pam. Thanks to both Pam and Kim. I think it's really great to get more kind of tangible examples of what communities across Alberta are doing in this area and all of the resources and opportunities available to support our efforts. So in regards to the Policy Coalition, if you're interested in learning more about the Coalition's work, if you'd like to access the Alberta Nutrition Report Card or resources in our Policy Hub, you can head over to our website. And if you have any questions, feel free to email me. And I've also included our Twitter handle if you want to stay up to date on our activities. And just before we head into questions, I just wanted to share this quote that I shared during our first webinar, which I think nicely captures aspects of the healthy public policy process. So I hope we've provided some helpful insights to support your efforts here today. And with that, I'll pass things over to Kelly to moderate the questions.
Thanks, Kayla, and thanks to Kim and Pam for that great presentation. It's good to see there's so many communities out there that are interested in this work and are striving to implement it. So we've got some questions in the queue already, but again, if you think of some or if you have one that you want to ask, go ahead and type it in. So the first question, and Pam kind of answered it already, was just what you're using to determine what healthy foods are, and I believe that was the Alberta Nutrition Guidelines that you referred to, right, Pam?
Yes, I did. And one of the things we've just recently created that will be going out for review and might help people is kind of just a quick guide to choosing healthy foods. So if that's something that you're interested in, it just kind of goes through, kind of instead of having to read all through the guidelines, it kind of just gives you a guide through procurement of food and basically cooking methods or, processing to what turns a really healthy food into one that might turn it into a choose least often. So that's something that's coming out, and if that's something that you're interested in, we could certainly take your contact information and send that.
Okay, great. The next question is from Francesco Palladino. What are your thoughts on the feasibility of encouraging privately funded business to support healthy food procurement?
So I don't know if that kind of goes along. Oh, sorry, go ahead.
Well, I was going to say, I was just going to jump in, like your example of the vendor for the vending machines in central Alberta. That's a private business, right? And they made the decision to source healthy products, recognizing that they could indeed serve people where there is a demand. And I think as long as we can continue to ensure businesses that there is a demand out there, that they are going to be open to providing healthy choices. There are certainly some private businesses who make their whole business off of providing healthy choices, and there's a reason for that. There is a demand for it. So I see lots of potential partnership with private businesses in providing healthy choices.
When I was just going to jump in, and even when I saw the next one around things like Dairy Queen, et cetera, that I have seen examples. So for instance, the city of St. Albert, which I know the Policy Coalition has on their website as a policy story, one of the things they did is they required those retail food services that are within their building to have certain parameters around healthy food options. So I don't think they changed, for instance, it might have been a Starbucks, they might not have changed the drinks per se, but they might have been changed around what are the baked goods, et cetera. So there are ways around, as a municipality, writing in contracts and leases that if you are going to be a part of our facility, these are some of the parameters. So you can even work, amongst some of those larger chains.
Okay. The next question, or the next comment, like you mentioned, about Dairy Queen being the only choice for food on Leduc and Fort Saskatchewan. So, like you're saying, one option would be for the municipality to write into the contract if they're required to offer a healthy option. Yeah, for sure. And I know that some of them have had partnerships in that where they go across, like where they're, if they're zoned close to a school, right, where they only have certain options available at lunch hours, et cetera. But there are some workarounds in terms of writing into contracts that you can work within even those retail environments. Yeah, and I think that's really useful for a lot of our smaller municipalities too, because I know there's kind of that struggle between attracting business but not wanting to impose requirements on business that will deter them.
That's certainly something that we've come up with our local food environment mini nutrition report cards project. So that it is a concern, but businesses are usually open to making changes like Pam suggested, if they know that there is a desire for people to move in that direction.
Yeah, and I think you mentioned one of the vendors that you had come across had actually increased their profitability by offering healthy choices along with their regular offerings, right?
I think one thing to remember, and I mean, I happen to be a hockey mom, so I spend a lot of time at the rink, but I think part of what sometimes is happening is there's that whole untapped market of people who are looking for healthy options, and when there isn't any of those available, you're missing out on that whole market of people who are now packing their own food, et cetera, because they're looking for those healthy choices. So it's also kind of looking for a bit of balance, right? That some people are coming for that treat, but those of us who are coming like right from work and nobody's eaten supper, like there are some of us that are looking for those healthy options. And so we've seen success with people, but then part of it is if you did serve only, less healthy options and now all of a sudden you've added them, you need to do some marketing and promotion to make sure that people are aware that you now have those options, right? So that's where I think some of those new infographics are going to really help support that work, and your local public health dietitians are certainly willing to support you as well.
Yeah, Pam, I just want to say I'm really excited about those infographics that you're using, because typically what has happened in the past is people say, well, we have fruit, but it's hidden somewhere behind the cash register, so people actually don't know it's there, and then it goes bad because people didn't ask for it. Yet the candy bars are right out front. So, really just having those things like placement, putting the healthy foods right out front and making them look attractive, that can make a huge difference.
Yeah, and we do have a supporting comment from Pat McIntosh that they found with their patron surveys, the vast majority of patrons wanted more healthy choices. Large untapped customer base that would be paying customers if healthier options were available. So yeah, that dovetails just with exactly what you were saying about that untapped market. Okay, what's our next question here? Our next question, and apologies if I mispronounced your name, Sanela Jerkova. So knowing that healthy and organic food is more expensive than junk food, and considering the increased rate of unemployment in Alberta, what policy and financial support will support producers and sellers of healthy food and will make it affordable for the low income and for all citizens?
That's a really good question. I mean, typically what we know about food insecurity, so people who are unable to afford healthy food, is predominantly related to income, not necessarily the cost of food per se. The cost of food is not that high in Alberta. As a matter of fact, we had a webinar on Wednesday where Canada has one of the lowest costing food supplies in the world. It's really more related to income. So I think what we really do have to consider is that, food is one need among many. And when people have to, balance out paying rent versus buying food, rent is going to come first because they need to have a place to live. So this is much bigger than food. This is an area where we really do have to look at social policy to ensure that everybody has an adequate income. I know basic income guarantee is something that's been proposed in the past, and maybe there's more of an openness to that now that we've had this COVID crisis and we've got the Canada Emergency Response Plan. So, it is a complex issue. And it's important for us to consider the economic environment as part of the food environment, but it's not necessarily the cost of food per se. It's really around people's economic viability.
Okay, great, thanks. Sorry, do you want to add something? Okay. So we'll go to the next question from Jill Harrison. What recommendations and resources do you have for culturally appropriate food?
Do you want to take that one, Pam?
I know, I was like, I've seen a lot of examples in Alberta of different ethnic backgrounds serving amazing different culturally appropriate food. That has definitely been different for rec centers. We do have a toolkit that we created for those that are more for newcomers, kind of thing. But I don't know if there's any resources per se around what are culturally appropriate, foods to have in recreation facilities. Some of it's based on what is your equipment, what is your setup like, who is your clientele, et cetera. So part of it is knowing your audience. So I would probably, say my first thing, like Pat mentioned, patron surveys have been something that if you have a food service operator that's kind of wondering around what would people do, what would they be willing to have, what are they looking for, like what cultures of people are coming to your facilities, and if they aren't eating, what would they eat? So probably a patron survey and getting to know your audience would probably be the best way to try and figure out, what you should have on your menu.
Okay. So we're at 3 o'clock. We still have some questions to go through, but if anyone has another meeting or other commitments that they need to go to, I just want to remind everyone that this webinar is being recorded and we'll be posting it on the AUMA YouTube channel. We'll send out the link in our newsletter next week. But I think if Kim and Pam are okay to stick around and just go through the remaining questions, that would be great. Do you guys have a bit of time?
Yeah, you bet.
Okay. So we have a few comments from Karen, Dr. Karen Lee. So with her NYC Fresh program, so they talked about creating, the city created tax and zoning incentives for supermarket operators to locate in food deserts, but these supermarkets had to have a minimum square footage for fresh produce. So that's another policy tool for municipalities to kind of incent dealing with food deserts. Do you guys have any comments on that? No? Okay, so Kendra Chow, do you have any recommendations for advancing zoning conversations when municipal governments often cite that health is not within their mandate?
We were having this conversation, so we have a municipal food environment working group within Alberta Health Services, and we were talking about how you almost have to not call it health, right? You have to look at what municipalities are looking at, and they definitely want a quality of life for your residents and that kind of thing. But I think just, kind of maybe sharing some of the stats and that Kim shared around, diet affecting so many chronic diseases, et cetera. And so I think, if you look at the long term and the quality of life of your residents, right, some of that conversation can maybe, move things forward. We were also, we have more questions than answers, I think, around zoning, so that might be questions for people who have actually done more of that work. So I don't know if Kim has anything to add.
Yeah, and Karen's got a comment too about using the terms health and well-being to move non-health folks into thinking about health beyond healthcare, and to look at what the priorities for your municipality are, and seeing how health and well-being work support that. So I think that's a really good comment. Okay. Next question, or a comment from Heather. Again, they did a patron survey in Lethbridge saying that more people would purchase healthy foods if they were available. Many of them were going elsewhere or packing their own food to have something healthy. And then just a few comments from Heather and Karen around the strategic plans for municipalities. A lot of municipalities are already including health and well-being of citizens in their strategic plans. You can also look at integrating healthy food environments and healthy built environments into the municipal development plans and master plans. Municipalities are responsible for doing those MDPs under the Municipal Government Act. So those are some more opportunities to look at food environments and just how you can incent those healthy food environments. Okay, a question from Catherine here. For the vending machine program of choosing healthier options, how are the choose most often, choose sometimes, and choose least options determined? Is it by content, so high sugar, high salt, high fat, or nutritional value?
So again, we have the Alberta Nutrition Guidelines that have a nutrition criteria, but sometimes it's working. So the nutrition guidelines really look at limiting the amount of sugar, salt, and fat from the diet. And so sometimes, though, you have this amazing food that meets all of the different criteria except for maybe one. And so sometimes it's just looking at some of those products and kind of going, it's still a healthier choice. Like if we were removing all the chocolate bars and all the regular chips, and we were looking at having baked varieties and some of these other things. Like for instance, we've run into problems with like a flavored popcorn, for instance, where it's like it meets all of the other criteria except maybe it has a little bit more sodium than what it should be, but it's still a better choice than other things. So we're still working towards having manufacturers create products that have better nutrition in them, so less salt, less sugar, less fat, and more nutrition. And so, as we catch up and have manufacturers create more of these products, we might have to make some of those judgment calls. But we try as much as possible to use the nutrition guidelines criteria.
Okay. And then a question from Francesco. So, do you foresee any increased partnerships between different professions, for example, dietitians, health inspectors, people working in health promotion, at different facilities in order to achieve the objectives of disease prevention? And then Catherine had just noted that she thinks some of those collaborations are already taking place in a lot of municipalities, depending on the zone. So, Pam, in your experience, have you seen any of those partnerships?
Yes, I was going to say I'm in a zone where we are doing that. It's in its infancy, and so what we're realizing is that we all, at the end of the day, in all of our different departments, all have the goal of safe and healthy environments for residents, and so we have started having meetings. They're happening at the provincial level, with safe and healthy environments, with some of the environmental public health stuff. Our director for nutrition services is at the table. Health promotion is at the table. So this work is really happening. It's new, but we are starting to realize that the more that we can work together, that we're going to have better impact. So watch for more of that to come. But yes, we are starting to do that.
Great. Yeah, and I think too, especially with this pandemic, there's going to be a really increased focus on health and public health and how to support that. So there's kind of a real opportunity, if your municipality hasn't been as focused on health before, to really push that. And people are realizing how much everything depends on people being healthy if they had never really thought of it before. So I think that's it for questions. Kayla, did you want to wrap up? I just want to say thanks also to Karen Lee for putting in some of the comments and answer some of the questions based on her experience. It was great to have you along with the webinar.
Thanks, Kelly. I think your last comment summed it up nicely regarding just the importance of health to citizens and municipalities as a whole. So I think thanks everybody for joining today's webinar. It's been really great to partner with Alberta Urban Municipalities on this series, and we're so appreciative to Kelly and the AUMA and RMA for all of their efforts. As you click out of the webinar, there'll be a post-webinar survey, so we'd love to hear your thoughts and insights on how you thought the webinar went. And we encourage everyone to get in touch if you'd like to learn more or you have any thoughts you'd like to share. Thanks, everybody. Have a happy Friday and a great weekend.